Did you know that every 40 seconds someone in the US has a heart attack? As a nurse, recognizing the signs and knowing how to respond can save a life. In this video, we're going to cover the definition, the pathophysiology, and the risk factors of myocardial infarction. Let's start by defining what is a myocardial infarction. To start, it's another way to say heart attack, and it occurs when blood flow to the heart is blocked, causing damage or death to part of the heart muscles. Now let's look a little further into the heart. The heart muscles, also known as the myocardium, needs a constant flow of oxygen-rich blood cells in order to keep working properly and are delivered through the coronary arteries. Quick refresher. Arteries supply oxygenated blood to the entire body. The coronary arteries, which are located in the heart, provide oxygenated blood to the heart. In most cases, heart attacks occur due to atherosclerosis, a condition where fatty deposits, also known as plaques, build up inside the coronary arteries over time, narrowing the vessel's diameter. The extent of the damage depends on how long the arteries remain blocked and which coronary artery is affected. Alright, so let's look at risk factors now. There are several types of risk factors. The first risk factor is modifiable risk factor. These are factors that can be changed. The second factor is non-modifiable risk factors. These factors tend to be things that are not able to be changed, like age. Alright, so let's start taking a look at what are the modifiable risk factors for MI. Let's start with smoking. We all know smoking is bad, but it also damages blood vessels, reduces oxygen in the blood, and promotes plaque buildup. High cholesterol. Excess LDL, also known as bad cholesterol, contributes to plaque formation in arteries. Hypertension, also known as high blood pressure, increases the workload of the heart and damages arterial walls. Diabetes. High blood sugar levels contribute to vascular damage and increased risk of atherosclerosis. Obesity. Excess body weight, especially around the abdomen, is linked to higher cholesterol, blood pressure, and diabetes. Physical inactivity. A sedentary lifestyle weakens the cardiovascular system and contributes to obesity and high blood pressure. Chronic stress. Long-term stress can lead to increased blood pressure. Now let's look at non-modifiable risk. These are risk factors that individuals cannot change but should be aware of for early prevention and screening. The non-modifiable risks for MI are age, gender, family history, and ethnicity. Remember, non-modifiable means you cannot change, so non-modifiable risk. And this brings us to the end of part one of our series of myocardial infarction. Don't forget there are three parts. Part two will cover symptoms and diagnosis, and part three will cover treatment and nursing interventions.